Have you ever wondered why some women take part in anal sex? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to explore that topic together. Over time, we've seen that participation in anal sex among heterosexual couples has become more common. However, there is still very little clear understanding of why women decide to engage in it. Is it because they see it more often in media? Do they feel pressure to satisfy their partner? Or is it something they personally enjoy? In a 2014 study, researchers set out to better understand women's experiences and thoughts regarding anal sex. In this study, anal sex was clearly defined as penetration of a woman's anus by her partner's penis, not including other related activities like oral or digital stimulation. The researchers organized 4 focus groups, including a total of 32 women from different ethnic backgrounds. These participants were selected from 2 places: an outpatient drug treatment program and a community-based sexually transmitted infection testing center. All of the women reported having anal sex with a male partner and also had a history of illicit drug use. It's not entirely clear why drug use was required, but one possible reason is that researchers wanted to examine whether substance use played a role in these experiences. The women were asked how often they had engaged in anal intercourse throughout their lives and with their current or most recent partner. They were also asked whether their partner was new, casual, or long-term. In addition, the study explored whether alcohol or drugs were used during these encounters, along with other details such as the use of lubricants or enemas, and where the activity took place. From all this information, researchers identified 6 main reasons that were commonly shared among the participants. The first reason was being under the influence. Some women reported that they had anal intercourse while they were under the influence of drugs or alcohol. Another reason was personal desire, where individuals chose to engage in it because they found it pleasurable. For others, it was about pleasing their partner. They wanted to satisfy their partner's wishes or meet their expectations. Another common reason was avoiding vaginal sex. For example, some women preferred anal intercourse during their menstrual cycle or as a way to reduce the risk of pregnancy. In certain cases, there were even situations of exchange, where women engaged in anal sex in return for money or drugs. Another important issue that came up was the lack of clear consent or situations involving pressure. Some women shared that they did not truly want to participate, either because they didn't feel they could say no, or because they were pressured or forced. Looking at the numbers, about 62% of women were under the influence when they had anal intercourse. Around 53% described situations where they did not want it but felt unable to refuse. Meanwhile, 49% said they chose to engage in it willingly, which is nearly half. Going a bit deeper, many women explained that their partners encouraged anal intercourse as a way to try something new, exciting, or different from past experiences. Some women also mentioned that they would only engage in it with a special partner or during a meaningful moment, almost like offering something personal to someone they trusted. While some women did enjoy anal sex, most still preferred vaginal intercourse. Those who had positive experiences often emphasized the importance of using lubrication and taking things slowly. On the other hand, women whose partners were more self-focused, inattentive to their needs, or inexperienced, especially those who didn't use lubrication, almost always described the experience as painful. Some even reported feeling emotionally uncomfortable or humiliated afterward. So, what can we take away from this study? It's important to remember that this was a small study focused on a specific group of women with a history of drug use, so the findings may not apply to everyone. However, aside from the influence of substances, many of these experiences may still reflect what other women go through. If you are the partner initiating anal sex, communication is essential. Use lubrication, make sure your partner feels prepared, and go slowly. If you are on the receiving side, be open about your comfort and boundaries, and never continue if something causes pain. Always use protection, and consider learning more about safe practices. As always, thank you for watching. If you found this helpful, Consider subscribing and sharing this channel with others. And remember, take care of yourself because you truly matter.